Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, doctors, today what I want to talk about is how do I teach attorneys how to diagnose their clients that may have a spinal ligament injury. I spend a lot of time helping doctors to better understand spinal ligament injuries because spinal ligament injuries, of course, are one of the most serious injuries in the market today. Any doctor that understands these ligament injuries, understands how to work them up, how to image them, what the guidelines say about them, what the actual consensus is around them, and it's serious. The consensus is that they are significant injuries. They are the most expensive injuries probably in the market today. Now, not as an individual, but because there's so many of them. There's just so, every 7 seconds there's an auto injury. Every 7 seconds there's a work-related injury. Every 2 seconds there's a home-related injury, right? And probably 60% of these injuries are spine-related. And when you get into the spine-related injuries, that's why they're so expensive, because there's so many of them. There's just so many of them. So the doctors that understand these injuries and can do 3 things with them, 3 things really well with them. 1, they can actually understand and get them diagnosed properly. 2, they can basically also get them imaged properly. And then 3, they can actually treat them to a great result. Those doctors should be the highest paid doctors in the market today, bar none. There wouldn't be another doctor that's more valuable in the market. So I teach a lot. Hey, look, there's only 3 injuries that you can have. You can, spine's only 2 tissues. It's basically bone and connective tissue. So you're only working up 2 tissue injuries, connective tissue injuries and bone injuries. And the majority of them are not bone injuries. They're connective tissue injuries. Right? They're pretty simple to work up. The imaging biomarker for a disc herniation is on an MRI. It's a herniation. The imaging biomarker, and by the way, imaging biomarker is the definitive thing you see in image that indicates that you have the correct diagnosis. So an imaging biomarker for a fracture is a separated bone. It's a fractured bone. Imaging biomarker for a non-disc ligament is excessive motion. The imaging biomarker for a disc herniation is a herniation. So it's pretty simple. The spine only damages in 3 ways. It just easy causes, if you damage the spine, you cause excessive motion, you cause disc herniation, you cause fracture, or you cause combinations thereof. If you have a disc herniation and all you have is a disc herniation on MRI, basically you have a pre-existing condition. There's nothing that says that that was caused by the current accident. And the reason for that is because you don't actually have the other tissue damage that would be consistent with the new injury from the new accident, because the force has to go through those other tissues to get to the disc in the first place. If you don't understand that, man, you don't understand disc or spinal injuries. Again, there's only 3, but what I want to talk about today is, I teach a lot of doctors how to go out and how to have very, very successful talks with attorneys. And very successful talks with attorneys. Now, why does what I call a smart injury doctor, why would a smart injury doctor want to go and have a successful talk with an attorney? Well, 1, because he's saving lives. He or she is literally saving lives. Basically, what I'm saying is they believe that they can reduce the risk the patient has for long-term residual complaints, i.e., they believe that they can get great rehabilitative results because they understand what they're doing with these injuries. So why wouldn't they go out and promote to attorneys? Why wouldn't they go out and promote to other doctors? Why wouldn't they go out and promote to the public? Why wouldn't they go out and promote to the insurers? Why wouldn't they go out and promote to employers? Why wouldn't they go out and report, do meetings and do presentations for unions? The only people that they will market to, and the only people that they should be concerned to market to, are people that are interested in results. They're interested in results. They're not interested in gimmicks. They're not interested in the latest, greatest. Hey, let me show you how I'm going to increase your claim value, and let me show you how I'm going to make you a lot more money. That's a gimmick. right? If you do great injury work, you're going to do a lot of that. You don't need to talk about it. It does not make you unique. As a matter of fact, it makes you, in my world, it kind of makes it a little bit sleazy, because if the person that you're communicating to can basically come to their own conclusion about you without you having to say it, that's beautiful marketing. So when I'm out and I am doing talks with attorneys, I teach them how to diagnose what do they need to look for in a client, in their client. What if they have a particular client, what is the client that has the spinal ligament injury that's usually gone undiagnosed, right? So I'm the doctor, I'm talking about these ligament injuries, and again, remember there's 220 specialized ligaments, 23 are discs, the rest are non-disc ligaments, anterior longitudinal, posterior longitudinal, two transverse, two capsular ligaments, ligamentum flavum, interspinous ligament, supraspinous ligament. Those are the basic ligaments. We also have things like the interforaminal ligaments, right, that we could talk about. Great conversation. If you don't know what they are, look them up. Interforaminal ligaments. They're super significant ligaments. They're the ligament fibers that basically hold the blood vessel from the nerve in the foramen. Now, problematically, if there's hypermotion, because they cross the motion unit, they're hyperstretched. And when they hyperstretch, where do they have to swell? Right in the nerve, right in the blood vessel. That's where they swell. So if I'm out, but remember, what I'm talking about today is, what do I say to the attorney? How does the attorney, I'm brand new, I'm just coming in, right? You got all these doctors that are in the market that are trying to take up the space, or they have their relationships already, and they do the, hey, here's what this doctor does. This doctor's, I do some treatment, I send people out, I get an MRI, I send them out for an injection or two, and that's what I do. And I do it on every single patient. And my attorney knows, the attorney knows that, so they refer in. How do you interfere? How do you break up that relationship? How do you break into that network? Right? Well, first of all, you're going to have people that have very high dollar policies, right? So that crappy, I do an MRI, I do a little bit of care, I do a pain management, is not going to work. It does not work for those. It does not work for those. So what do? Well, you actually do a workup that is a complete workup, right? So what is a complete workup? Well, a complete workup goes way beyond just a disc workup. It goes way beyond just a MRI. It goes into a excessive motion test. And when you get into excessive motion testing for non-disc ligament damage, then you get into things like, all right, is the system FDA cleared? Are you not doing image manipulation with these images, which is a big no-no. And it's going to be even a bigger no-no in the years to come. I mean, the systems that do that will be gone. And so, but I'm sitting there with the attorney, and gosh, how do I get the attorney to know that these ligament injuries are significant beyond the disc herniation? It's real easy. Good. So I'm going to say to the attorney, hey, attorney, I'm going to teach you right now in your practice right now how to determine if they have a non-disc ligament injury. Usually it's been undiagnosed. I go right into your files. It's been undiagnosed. Your client's working with a doctor that doesn't probably even know what they are, or doesn't know how to determine it. And if they don't know how to determine it, they don't know what's there. And if they don't know what's there, they don't even know how to treat it. And that's why they're getting bad results with it. Remember, you can have a non-disc ligament injury that is severe enough that it qualifies the patient under surgical guidelines for spinal fusion surgery, and the person does not have to have a disc herniation. So again, going back to the attorney, when you go into your office, you go back to your office, the first thing you're going to look for is negative MRIs. If you have a negative MRI and the client has symptoms, they have this condition. And if they're working with a doctor that doesn't know how to work it up, that's not good for them. Not good for you either. And because if they don't know how to work it up, one, they don't know how to work it up. Two, they don't know how to document it. And three, they're probably not going to get good results with it. Right? Number two, when the symptoms don't support a disc herniation. If anyone on listening to this call, go out to Medscape, go to Medscape and say, what's the clinical presentation of a cervical disc herniation? It's going to tell you basically pain and radicular pain. It's not going to tell you anything else. Pain and radicular pain. Now, if I go to the clinical presentation of a cervical sprain, it's going to tell you a hell of a lot of symptoms. It's going to tell you that you can have pain, you can have radicular pain, you can have heaviness and weakness in the arms and the legs. It's going to tell you that you can have post-concussive syndrome. It's going to tell you that you can have vision problems, balance difficulties, concentration problems. It's going to tell you that you can have headaches. It's going to tell you that you can have scapular pain. It's going to tell you that you can have tinnitus. It's going to tell you that you have a hell of a lot of other symptoms, right? So one, if your client has more than pain or radicular pain as a complaint, they have this condition. And it's usually been undiagnosed. And undiagnosed injuries are very problematic for settlement processes. Because anytime you minimize the injury documentation, you put a problem in place for the settlement process. And then the third is your client's not getting better. Your client is not getting better. They've had a hell of a lot of treatment, but they're not getting better. They have this condition. They've went to the physical therapist. They went to the medical doctor. They went to the specialist. They got the injections. They got the nerve burn. They got whatever. And they're still not doing well. They have this condition. Right? Now you can also say, hey, look, they have a diagnosis of mild traumatic brain injury and they're not resolving the symptoms. It's the same thing. They're not doing well. Why are they not doing well? Because the cervical profile injury associated with the mild traumatic brain injury has not been addressed. So basically, you walk into your office, negative MRI, complaints don't match the disc, and you got a client that's not doing well under care, and they've had a hell of a lot of care and a hell of a lot of money. There's nothing about this type of injury in that file. That's what you have. So I can teach them to diagnose their clients. I can also teach you to do the same thing, right? I can tell you this on a podcast, and some of you will take it and you'll run with it. But I'll tell you won't be as successful with it is if I basically train you in it. That's what the Smart Injury Doctors program is all about. It's about showing you there's a unique niche in the injury market, and you can take advantage of that niche. I don't care where you are, how big the city is you're in, or how small the town is that you're in. It doesn't matter. If you want better results, and you want to be the top of the chain, you want to be the top professional in your area for spinal injuries, it's information that's pertinent to that. I don't know how anybody can be a spinal injury expert without understanding what I'm saying here on this podcast. And that's what I'm trying to do. I'm trying to actually elevate the injury market so that they get better results with patients. And that's what we're trying to do. Doctors, in these podcasts, what I do is I just kind of riff on a very short topic. Hey, here's a topic. I train the attorneys. What are you looking for? Negative MRI. Symptoms aren't consistent with a disc herniation in clients that aren't doing well. They have a spinal support ligament injury that's gone undiagnosed. I can almost 100% guarantee it. Nobody can 100%. I can't 100%. That's why I say I can almost 100% guarantee it, because I see it day in and day out, over and over and over again. So, and I teach it. And the doctors that I teach are called Smart Injury Doctors, and I believe they're some of the top injury doctors in the country today. And again, spinal injury doctors that can handle these soft tissue injuries do three things with them. One, evaluate them properly. Two, document them properly. And three, then get great recovery results with them. Should be the highest paid providers in the market today. So if you're interested in our program, call us at 800-940-6513, and I'll demonstrate our program for you. You can also go out to www.smartinjurydoctors.com and you can look us up. You can look us over. If you have questions, send them to Dr. Kronk at smartinjurydoctors.com. Doctors, as always, I appreciate your time, your attention, what you're doing in the market, and I look forward to delivering more content for you on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.